Antibiotics have been useful to us for hundreds of years. However, the antibiotics are being resisted by bacteria and viruses. Because we have been using the same antibiotics for so long, sometimes when there's no virus even present, the viruses have mutated and adapted to survive the antibiotics. This is a serious and growing issue in medicine today.
Statistics show patients with infections caused by drug-resistant bacteria are generally at increased risk of worse clinical outcomes and death, and consume more medical resources than patients infected with the same bacteria that are not resistant. And each year in the United States, at least 2 million people become infected with bacteria that are resistant to antibiotics, and at least 22,000 people die every year as a direct result of these infections.
To prevent further antibiotic resistance, patients can follow the following actions of cleanliness to prevent infection, asking the doctor to perform tests on them to ensure that the right antibiotic is prescribed, taking antibiotics only when they're sick, and not saving antibiotics for the next illness.
According to the CDC, following simple hand hygiene helps prevent infection spread. Leading efforts to improve prescribing practices in your facility also helps. Staying aware of antibiotic resistant patterns, stopping widespread overuses of antibiotics, prescribing the right antibiotics at the right dose for the right duration, and documenting the antibiotic at that dose at that duration.